Good evening, viewers. Hope all of you are doing truly well. Today, of course, Truwellth online health channel, which aims to separate science from hype by sharing authentic knowledge and wisdom from healthcare and nutrition stalwarts, so you can make the right health and nutrition choices, is here with Dr. Anil Bhoraskar, who is one of the most renowned diabetologists from India and has been practicing at various institutions, including KEM Hospital, SL Raheja Hospital, Asian Heart Institute, and Asian Cancer Institute. He has been studying personalities and peculiar behavioral characteristics in his diabetes practice over the last 4 decades, which has greatly enhanced his diabetes management outcomes. After the huge success of Truwellth's session of personalities and peculiarities impact on diabetes with Dr. Anil Bhoraskar, Truwellth Integrative Healthcare is privileged to reforecast this fifth episode of Vyakti and Valli, which is personalities and peculiarities in diabetes management. Today, we cover polycystic ovary syndrome, PCOS, a condition that affects 1 in 5 women and is one of the most common causes of female infertility. More than half of the women with PCOS develop type 2 diabetes by the age 40. Lifestyle can make a big impact on insulin resistance, especially if a woman is overweight because of an unhealthy diet and lack of physical activity. This is what Dr. Anil Bhoraskar will share his pearls of wisdom on. And so, really, over to him to listen into him.
Friends, this problem is now growing, and I thought it's important that I discuss this freely with you. And this is going to be a every household complex problem. Polycystic ovarian disease, which is as common as having gray hair after the age of 40. You get ovarian disease from the age of 11 to 16 in young girls who have early menarche, who come to or brought to us by anxious parents for two things. One is early menarche, and second, hirsudism. Hirsudism means what? 3 or 4 here, 4, 5 here, but the mother is extremely worried. इसके चेहरे पे बाल है, and obesity, which is very peculiar, which will go into exactly a group of childhood obesity maturing into an adolescent obesity. This is a problem in our country now. We never used to see this much. But now you see these young girls between the age of 11 and 16. Their waist circumference is 96 centimeters. Their weight is more than 50 kilos. A 12-year-old child, more than 50 kilos, his risk is thick folds, thickness, mild acanthosis, and you do their ultrasound, they have maybe one finger palpable liver, and they have 1 or 2 cysts in the ovaries and abnormal menstrual cycles. You do their hormonal profile, prolactin, T3, T4, T, all normal. But you go into their diet history and you'll realize that these girls have never eaten at home. They are thriving on chips, colas, farsan, vada pav. They do not know what is roti, dal, sabji, salad, and they just eat this chakna. And for the want of scholastic responsibilities and for the want of competition, they have hardly any time to pay attention to breakfast, exercise, wholesome, nutritious food, and they pack the canteen food or they eat something which is available outside, and all of them have this problem. So Manjua Champan area was one example of that. Her height was luckily okay, she was not stunted, but she had a peculiar obesity and she was entering into adolescent age group where secondary sexual characters were developed, but they were dominated by the rest of the body's obesity. So obviously parents were very much worried. She would probably spend more time on the screen, at the screen, less time in the Maidani Khel, the no concept. She had never gone for jogging or anything else, nothing, no outdoor activities at all. School, 3 tuition classes, which is a normal thing. I don't know why they need 3 tuition classes, because I think the schools don't teach, or what they get in the school they feel is not adequate for them to get good grades. This girl was a brilliant girl. She was in first 5, more than 80%, but her lifestyle the whole day was completely wrong. Lack of sleep, like teenagers, they sleep for 5 to 6 hours. It's fashionable to sleep less. You need 8 hours of sleep. This girl was barely sleeping 6 hours because I think 2 hours after dinner she would spend time on her mobile. And I told her father, why the hell did you get this for her? अरे क्या पागल हो गएगा सर? वो नहीं लेते तो दूसरे को लेके आती है. टीवी तो हम बंद करते हैं 10 बजे. Then she's in her room and stuck up to mobile till 1:32. I don't know what they have to talk. In morning she gets up barely 8 o'clock and she has to rush to the school. So I said, this timetable is wrong. And how much milk does she take? I said, she doesn't drink milk at all. Why? She doesn't like it. I said, no child likes milk. You have to give them something to add flavor to that. No, she throws tantrums and she's very argumentative. She and my wife are constantly fighting. I said, this is our age group. A 16-year-old girl is bound to have a constant dialogues, constant argument with her mother. Because mother wants to do certain things and she doesn't want to do certain things. And mother's behavior is not very much ideal as well. Means mother spends a lot of time in kitty parties and watching TV. So you know what right she can tell her daughter. So I said, you have to change the whole family culture. I said, I try my best. Husband was very sensible. Father was a very sensible man. He himself was a gymnast and a very big executive. But he was really fed up with this girl. And then she had those tantrums because her parents were quite reasonably good looking. But this girl had become slightly dark and her face was slightly swollen. So she was like a young 16-year-old. She had the charm of the youth, but she was not, you could not classify her as a good looking girl, which was a very big setback for the family. Because mother was constantly telling her that if you like this, how will you get married? And who will, તમે પસંદ કોણ કરે છે? આ તો અજન્મ કુમારી જ રહેવાનું તમારો પ્રોગ્રામ છે કે? This kind of dialogues are not desirable, you know. I try to talk to the mother. I say, look, you know, she's a sensitive girl. She knows her responsibility. Nobody, કેટલી ugly દુખે છે. અરે, don't call your daughter ugly. You tell her that, well, she need to use it. Then I told her, can you take some exercise? He said, I got so many classes, this, that. I said, at least 1 hour in a day you can take out. You go and join swimming pool. It's the right thing to do. I said, Matoka Gymkhana is a beautiful swimming pool. There's a special ladies' time, and that's the time you're a little free. At least 3 times a week you try swimming. She said, not possible, you know, costume mein to main kaisi dikhegi. She had that embarrassment because she was a little reluctant wearing a swimming costume and swimming. Then I say, you at least start going for walks or at least do skipping. Reluctantly started, she joined some gymnasium. I think she went for precisely 8 days there. And then she said, I'm getting severe backache. Backache because there was no tone. The muscles were very weak. And she had never done exercise in her life. And that bloody instructor in that gymnasium, the day one, I think, gave her an exercise like an athlete. So she was completely put off from that gymnasium. And then she said that, then I said, better in that case, you at least stick to the home food. You make sure that, I told Mrs. Champaniria that, look here, at least this girl, you don't give her any canteen or hotel food. You ask, you prepare a food at home. Aloo methi ka bhaji, chole, little bit of salad. Try to pack up that in a dabba. Dabba. She says it is completely unfashionable to eat dabba in the college. I say, means what? What do the college? They all go to canteen. I say, they don't take home food? No. You feel shy to carry home food? And the mother also said, it will be difficult for me to cook for her every day. Means I know where is the problem. I knew the problem is with the mother. So mother buys fast food and gives to her, and she has no virtues of right food. And she went on eating burgers, chips, and reflexively sit in the canteen, order cold drinks, and with that the group sits and chat, and while chatting they are eating French fries. I say, you know all this, how many calories and what is the loaded calories you are taking? She said, but then I feel very hungry. I said, hunger is a part of the age. But you should take salads, kakdi, cucumber, doc. But it looks so shabby to carry cucumber and... I said, carry cucumber and salads, cut into nice boxes. There is nobody in the house to do that for me. Then you learn it yourself. You're a girl, next day you're going to become a housewife. So you should know, I have never entered kitchen. She has never entered kitchen because her mother also hardly entered the kitchen. All the cook is prepared by some Maharaja in the morning and Gangubai. I said, this is a formula it's a prescription for trouble. So I explained to her, I said, no, you give me some medicine. Because there is one dietitian who gave me a diet, and with that she gave me metformin. I said, this is a fantastic country where the dietitians can prescribe metformin. I have not heard anybody doing that. No, she also said that you should take thyroxine also. So I said, this is a very learned lady, I think this dietitian. If she was giving you thyroxine without doing T3, T4, TSH, without T3, T4 is normal, she is giving you thyroxine to reduce weight, she is a dangerous woman. I don't think you should patronize such diet centers. Do scientifically, metformin, but my polycystic ovarian disease, your polycystic disease is very mild. You don't have very grossly altered menstrual cycle. You don't have any serious problem, which can be totally rectified by change of dietary fads and diet and exercise, and you will not need any medicine. So as such kind of counseling has its own effect, this lady stopped coming to me. Parents also got fed up. Mother particularly did not like me at all. બહુ મસ્તીવાલા છે ડૉક્ટર. ખુદ લોग બહુ શાણા સમજે, मतलब possible. Luckily for this girl, she got married somehow. I think the boy must have got married to her looking at her father's wealth. But boy was from a decent family, and 2 years later, how I came to know, because somebody in the relation is also my patient, and they were telling me about this, that Manju got married, that was very good, congratulations. 2 2 years later, when she became pregnant, after a prolonged try by some infertility clinic, I don't know in 2 years why people become impatient that they don't have an issue, because I think the in-laws were insisting that she should immediately become pregnant, which was not possible. So there was an assisted pregnancy, they're reasonable. They gave some hormone replacement and all, she became pregnant. After pregnancy, in the during course of investigation, they discovered that she has a gestational diabetes. Now that was a shock to the family, that she had no diabetes earlier, she had no thyroid problem. Gestational diabetes mellitus, again only one name rang, Dr. Bhoraskar's clinic, and reluctantly Manjula, when she came, I'm smart enough to realize that she's Manjula, but I had to pretend that, oh my God, I did not recognize you, there's so much of change, which of course this sometimes is pep talk we give to a patient to win their rapport. She was looking more or less same, and she had a gestational diabetes pakka, fasting sugar more than 126, post lunch around 145, HbA1c 6, not accepted at all in pregnancy. So I told her that, look here, this is a time when you have to be extremely careful, because metformin she was carrying on metformin. But I am not, I say, comfortable with metformin to you, because if the HbA1c doesn't come down by 5.5, which is the criteria, in 3 months' time, I'll put you on insulin. What? Insulin? I say, look here, some people like to continue metformin, but I am not very comfortable, because the baby's weight will start growing. And this time this lady was a transferred person, and when I write a diet for her, in a month's time she knocked off 2 kilos of weight, and she brought all of values like a complete normal values. No gestational diabetes. And we could continue metformin, didn't have to give her insulin. 7th month, but I was not comfortable, the baby was growing too big. So I said the only way to do is to give a small dose of insulin. So I gave her 4 units or 5 units, 3-4 times, monitor her very stringently. She delivered a normal baby without any cesarean section, full-term normal delivery. Beautiful child, slightly overweight, around 3 kilos. Child was little baby. But then this is the time when I explained to her that, look here, this is a warning signal. Gestational diabetes is pre-diabetes. In a polycystic ovarian disease, this can eventually another 4 years, 5 years down the line, if you don't watch out, and if you go to your mother's house and she feeds you with all the stuff that pregnant women are fed, and lactating mothers are fed with great deal of interest by the grandmother and mother-in-law, you will put on weight, you will not lose weight, and in another 2 to 3 years you will do pakka type 2 diabetes. She was smart. By then, I think this girl had a high IQ. She understood what I was trying to say. She went on a strict diet control. She lost, after delivery, about 5 kilos of weight. Her values were normal. Her polycystic ovarian disease is treated. One of the treatments for polycystic ovarian disease is marriage, by the way. So that she overcome her polycystic ovarian disease, her pre-diabetic state like gestational diabetes. Now she comes regularly, she is non-diabetic, she is hell and hearty, and she is very busy, she looks after her children, and most important, she feeds her child with a normal healthy diet. And the child is healthy, not overweight, brilliant, is in, I think, 4th grade or something now. I think he is on the 2nd grade. A nice healthy boy. And this lady is become a social worker and giving the virtues of diet to many of our local people. And she has really fought her polycystic ovarian disease after pregnancy, but with a tough early stage. So my friends, polycystic ovarian disease can be treated very seriously only with lifestyle management, very rarely with metformin and very, very rarely with hormone replacement. But we have to consider polycystic ovarian disease on the top of the priority list, and we should suspect it any patient with this slightly abnormal menarche or maybe delayed menarche or abnormal menstrual cycles. We have to investigate the patient. Thank you very much.